And as mentioned, my name is Jonathan Jackson. I'm a co-founder of Dimagi and the current CEO. Dimagi has been in the mHealth space for a long time, before it was even called mHealth back in 2002. And ComCare is an initiative that we're focused on building out in India, and we've been selected to join the business call to action. We're very thankful for the platform and its benefits that have already been realized by Dimagi and several ventures we're working on. ComCare overall is targeting a 750,000 CHW market in India. These are trained, accredited social health activists, also called ASHAs, that the Indian government has built up over the last several years in an effort to combat the healthcare worker shortage. A lot of countries outside of India as well have realized the power of community health workers, and so this is a growing market potential for mobile health technologies in general and ComCare specifically. We believe that ComCare provides industry-leading value to both increase the access of care, improve the quality of care, the experience of care, and ultimately create a data-driven management environment. The adoption that we've seen already in India is that 11 of the organizations that engaged in pilots with us in 2010, 8 of those are already scaling. In the mHealth sector for ICT4D, this is actually an incredibly high conversion rate. One of the complaints right now in the space is that there's a lot of pilots and nothing's really going to scale. So we're quite proud of those numbers, and we're targeting where we did 1 per month in 2010. We're trying to scale that up to 2 per month in 2011. So our target is to have, 2012. Our target is to have 24 new organizations through the pipeline by the end of 2012. And ultimately our goal is to be cash flow positive within 3 years and reach 50 different organizations, which will include 25,000 CHWs and millions of beneficiaries. Also, our evaluation, we believe, is best in breed in the mHealth sector in terms of the research that has already been done and the research that we have coming up. To give you a quick overview on the product, ComCare is a mobile health platform that connects to our cloud environment and allows CHWs to register clients, to track them longitudinally, and to provide checklists and decision support. There's an online video that you can reach if you go to www.comcarehq.org, which can give you a better overview of all the capabilities. But to highlight 2 very important ones, we believe the use of multimedia, which was originally designed in Afghanistan for the literacy support, is incredibly engaging for the CHW and ASHA community. They're now empowered to convey information to the mothers in a much more rigorous and believable format. So where the same message might be delivered verbally by an ASHA who is new to a community and not believed, when it's coming through the phone and it's audio or video, we're noticing a significant increase in the uptake of knowledge from the women, both anecdotally and then hopefully quantitatively in some upcoming studies that we have. And then the second innovative piece that we believe we have over the mHealth market is really our ComCare HQ cloud platform. So all data collected on these phones is coming back to our central cloud infrastructure where we apply our own data methodologies, and a term we use is called active data management, to better track the workflow and HR processes that improve underperforming CHWs and reward high-performing CHWs. So this data lets us know John Jackson as a CHW has only done 5 visits this week and you're supposed to do 20, versus Carter, who's done all 20 visits or 25, and we can reward him through the system. So in that case, this is not just about data collection or registering pregnant women. It's also about workforce monitoring and performance improvement. So the reason that ComCare really exists from a value perspective and what we believe we're increasing is the challenges in the CHW program space are access to care, particularly in the rural areas. Even when a CHW is high performing, sometimes they're only visiting the households close to them. So access to some of the more remote households is a problem. Quality of care is a consistently cited issue with CHWs. They're undertrained, there's high turnover, and therefore they're not able to provide a very effective intervention. And the experience that a client has with the CHW is often not a good experience. It's not believable, and it's not taken very seriously. Ultimately, the traditional M&E approach to CHWs is a massive problem. The reason CHW programs are effective in the first place is because they're distributed and that they're low skilled, and that also makes it a huge challenge from a workforce monitoring standpoint. Where ComCare comes in is to increase the access to care through the workforce management that I mentioned, increase the quality of care through our decision support and checklists, and increase the experience through multimedia. This allows us to both engage the client better, but also the community health workers love the platform. So whenever we go into a new community and deploy the phones, they're incredibly excited. They're bought into this idea of data-driven management. They want to perform better, and they want their clients to really take on the message they're saying in a more serious, proper way. And so we've seen that time and time again through our work in India and elsewhere. The evidence base, which again is industry leading, although sparse,